Hello, I'm Jean Pete, and I welcome you back to our show, Better Living. Better Living is brought to you by the Homestead Hope Foundation and is sponsored by Homestead Hospice, where commitment to education and premier hospice care helps patients and families through life's most important journey. Thank you for joining me again this week. Today, I am very pleased to bring you Dr. Hillel Mazansky, who is the only MD in the United States specializing in medical hypnosis and hypnotherapy. He also focused on guided imagery, visualization, and meditation. We're going to talk today about nutrition and exercise. I love his mantra. As you know, the show is called Better Living, and Dr. Mazansky fits right in. His mantra is that he provides nutrition, exercise, medical hypnotherapy, and guided visualization so that we can live a longer, happier, healthier, sweeter life. So, Dr. Mazansky, thank you so much for joining us today.
Well, good morning, and thank you for asking me. I'm honored to be on your show. This is the first time I've invited to be on the show as far as South, although your audience will want to know my accent. That's the first thing that they all want to know from. I come from far south in Alabama and Georgia. I come from South Africa. That's the accent. It's not English, Irish, Scottish, New Zealand, Australia, or English, because that's what they all mix it up with. It is South African. They all want to know what type of doctor I am. Well, you told me. The first thing I always say is I'm a good doctor, and then I tell them my speciality. So now the guesswork is out.
Well, you know, I thought maybe New Zealand when we were talking. I wasn't quite sure, but I love the South African accent.
Thank you.
It is a little bit like the English accent, which you probably hate to hear, but it's so much easier to understand and hear, and I just think it's more eloquent, a little bit more eloquent.
Right. It is actually more aligned with Australian than with New Zealand. But New Zealand and Australia, you're quite right, Gene. Because Australia and New Zealand, I even find difficulty in differentiating the two. You are quite right. It's more aligned with Australia and New Zealand rather than with England.
Well, I'm so happy to have you and your accent on the show today.
I'm happy to speak to you and your accent. I remember when I was practicing in South Africa, I had 2 American patients. And when they used to come in, I just used to love to listen to their accent. And I never knew that the same thing would happen to me in those days, that I would land up in America. And now it is especially the females that when I speak to them, they all tell me, oh, I can listen to you for hours to speak.
That's true.
So that's been a rather good asset for me, aside from all the others that I have as my accent.
Well, I bet that would work with hypnosis. They can listen to you for hours.
Truth be told, because this was once an English colony, you have the accent. I don't. Being with an English accent, it's Americans who have the accent. I speak real English.
Touche, you're right. We're the newbies, right? So it's our fault.
Right.
Well, you don't know this. Dr. Mazansky is joining us today from California, La Jolla, California. But I'm from the Northeast, Dr. Mazansky. But I've moved all over the South and Southeast, so I've lost a bit of my accent. But when I get real tired, I pack the car and have it yard.
Oh, yeah. Now you've got me beat. I don't know what you said. I don't know what you... But I've invited you, as we said before the show, to come to La Jolla, which is part of San Diego, but it's the nicest part of San Diego. And you come here and you will not want to go back.
Probably not. I don't think my boss would like that very much. But, you know, we can do this show from anywhere, right?
Correct. Absolutely. Once you're on the radio, you can be anywhere.
Okay. So I really want to get to all that you have to offer. You know, this show is called Better Living. We do gear our show towards seniors and older adults. But the more shows I do, the more I realize that everything we bring to audiences just to educate and inform people so that they can live their best lives. If you're educating and informing people how to live their best lives, it will apply to any age group. So I'm very excited to have you on today.
Correct. Now, a basic thing, my tenet is this. While you're catering to seniors who might be institutionalized in hospice, etc., I'm trying to prevent that eventuality by happening if after this hour's discussion, which I'm sure will be fruitful for all, if we can discuss how we can prevent that eventuality from happening by stepping in early in whatever the diagnosis is, be it physical or psychological. Mainly in the seniors, it tends to be more of a physical nature, such as cancer, chronic pain, insomnia. These arthritis, which is part of chronic pain, of course. But in the hospice, isn't it true that the vast majority of your hospice patients are cancer sufferers, Jean?
Yes, cancer is one of the largest hospice diagnoses.
Exactly, and that's exactly what I see in my office and on the internet, and we'll talk about the internet later on, how my videos are now on the internet. But the vast majority of my patients that I see in my office are all cancer sufferers. And of that, fits in with the American statistics that prostate and especially breast cancer are the two cancers that I see the most. Females tending to be more attentive to their health than males, who have this macho attitude of, I'm not going to the doctor type thing. I see more breast cancer sufferers than prostate cancer sufferers. And through the use of hypnosis, nutrition, exercise, guided visualization, I am happy to say I have a few patients that were given up for go home, don't buy yourself the old vinyl record, the long-playing record, as one doctor said, which I found rather interesting, but how can you say that to a patient? But he did. Don't buy a long vinyl record. In other words, you didn't have long to live. That they are alive and well when their doctors gave up all hope. Why? Because they underwent hypnosis. Now, I'm not saying it's just for me. I'm sure there are other hypnotherapists there, but I'm a medical hypnotherapist, meaning I'm a physician.
Okay.
A lot of hypnotherapists are psychotherapists, maybe even nurses, maybe social workers who've decided to have their bent in hypnosis, but there are very few of us that are physicians.
So,
see, when I do the hypnosis, I do it from the medical point of view because having had 45 years of experience as a primary care physician, I have chosen, especially for the internet, the 25 most important hypnosis videos that are there. But get back to the cancer.
Wait, before you go there, first let's kind of pull all the way back. Can you just simply describe what is hypnosis? And when you're talking about medical hypnosis, how does that work?
Okay, excellent question. Two things. Hypnosis is self-empowerment. Patients empower themselves together with their physicians to assist in their own treatment, because especially with cancer patients, they have their primary care, they have their surgeons, they have their oncologists, their radio oncologists, they have their chemotherapists, and everybody is doing things to them that eventually they get so tired and worn out. How about Mrs. Smith or Mr. Cohen, that you try and do something for yourself? How about you do your hypnosis twice a day? How about that you empower yourself with nutrition and exercise, a sound mind in a sound body? So hypnosis, to start off with, is a self-empowering tool. There is a lot of mysticism about hypnosis, mainly because of the word hypnotist. And people call me a hypnotist. I'm not a hypnotist. A hypnotist is a person who swings a watch or something in front of you and says sleep, or clicks their fingers, and you go into a semi-comatose state. That is staged and it's contrived. All that hypnosis is extreme relaxation. How does hypnosis differ from meditation or guided imagery? Meditation, you try to empty your mind of all your thoughts. I have studied a lot of meditation, and you have to really be adroit at doing it because it is very difficult to empty the mind of all thoughts. Come now back to hypnosis. With hypnosis, you fill your mind with such deep, intense concentration under a state of extreme relaxation, intent on treating and healing all your physical and psychological ailments. And that's exactly what hypnosis is. Nothing more, nothing less.
You know,
and
did
I
you
have met
read...
people.
Did
Excuse me?
I was reading it when you were talking about self-empowerment, guided imagery, using hypnosis and visualization and self-empowerment to help yourself heal and treat. I recently read an article about a CNN anchor, and I didn't know her name, but her face was very recognizable. Her name was Zane Verjee. Have you heard this story?
Yes, of course I know Zane. I don't know. I know of her. She's a very attractive female. I've seen her occasionally. Now that I'm so busy, I don't watch much television. But I know of Zane. Yes, I've heard her.
Well,
she's very erudite.
What I really... It struck me, obviously, because I remember this from a few weeks ago as you're talking, she suffers from severe psoriasis. And no one would know this because her skin on her face is perfect.
Yes, but psoriasis never affects the face. Psoriasis affects mainly the joints and maybe the abdomen. It affects the knees. It affects the elbows. And would you believe, you mentioned that, people flock to the Holy Land or to Israel, to the Dead Sea, and they go there and their psoriasis is treated. They go there and it's treated for a certain amount of time. There are two reasons why that happens. Psoriasis is caused, like most of our issues, everything comes from the mind. Cancer comes from the mind. Every cancer patient that I see suffers stress. All these autoimmune diseases, of which psoriasis one, comes from stress. So when they go to the Holy Land, to the Dead Sea, first of all, they're completely relaxed. They leave their stress and worries behind, so they're relaxed. There are also certain chemicals in the water, the high salt, the high magnesium, etc., which has a healing effect on the psoriasis. Plus, the third thing is that it's hot there, they get the sun. So those three things combined treat the psoriasis. But unfortunately, nobody can live there all the time. The minute they come back to their daily lives of their stress, anxiety, tension, it flares up again. And there are certain creams that we use, but I'm holistic now, Gene. I used to be, as I said, a primary care physician. I don't prescribe any medication.
Well, that's what she's talking about.
Another one of my mantras says, the mind causes all one's physical and psychological ailments. If the mind causes, which it does, the mind helps heal or treat using medical hypnosis and hypnotherapy, guided imagery and visualization, nutrition and exercise, how to live a longer, happier, healthier, sweeter life.
And I can't
sums it up in a nutshell.
Yeah, and I can't wait to delve deeper into this with you, but the reason I brought up her story, I don't know that you know her story, but what happened was she felt like a leper because she had this severe psoriasis throughout her body. And she wrote an article about this, so this is all public. She went to a small town in South Africa named George. And
George, I know it well.
Yeah, in this clinic, just like you're saying, and just like we're going to talk and teach and educate our audiences about today, it's all based on self-empowerment. And it specializes in treating these severe skin diseases. But the point of the matter is how much, through her own self-imagery and through exactly what you're talking about, self-empowerment, she was able to almost cure her psoriasis. And then at the end of the article, she talks about buying a bikini and going to, I think it was Nairobi, to spend a summer or a vacation there and actually wear a swimsuit for the first time. But she said this is mind, body, spirit at the focus of healing. And it talks about meditation, deep relaxation, creative visualization 3 times a day. I don't know that everybody realized just how empowered we are. And I hope that through our radio show today, your knowledge, your expertise, what you have to say, and then also sending them to this article. She's a CNN anchor. Her name is Zain Verjee, Z-A-I-N, last name V-E-R-J-E-E-I. I empower you all to read her story.
I think she's of Indian descent.
Is she? She's beautiful.
Yes. You know what I've done on television shows, and we did not discuss this. Would you like to take about 10 minutes or 15 minutes of your show, and I can try and do a mini hypnosis on you? We didn't discuss this, and I know I'm throwing this out.
Oh, Lordy, put me on the spot. See, you know what he did?
I'm putting you on the spot, but it's something that you and your producer could think about. I could take a 10-minute, hypnosis, let me explain to you, is divided into 3 parts. Its first part is induction phase. That is the relaxation. That's when I put you really under relaxation. If it is, all depends on the diagnosis, how deep I put you. The next phase is the healing or treatment phase. And the third phase is the return or comeback phase to the here and now. So because of the short time period, all I can do for you is the relaxation or the induction phase. But I'll just throw that out, and if you want to, I could do it in a short 10 minutes so that the audience can learn exactly what hypnosis is and listen to me do that. But you make the decision. Okay.
Well, I'll be brave, and I will tell you that I will do that. The problem is we're going to have to do that at the second half of the show because we're going to run out of time. But, okay, so can I just put a request in?
Yeah, please.
Do you focus on a specific area? Like, I got an email from you about how well you do with helping people stop smoking. Well, I don't really need that, but every middle-aged woman would love some help in being more disciplined about the choices she makes with food so she can lose weight. Is there any way in 10 minutes you can help me with that, Dr. Mazansky?
Yes, I do, and very, very few people do this.
Okay.
Have you heard of the lap band surgery?
Yes, I have.
Okay, well, for your listeners who don't know, in severe cases of severe obesity, we're talking 300, 350 pounds and more. They've tried everything, and obesity by itself is one show only. But to be brief, there are a lot of psychological ailments, psychological issues behind yo-yo dieting and obesity, but we're not going to go into that. You asked me about the weight loss. So in these severe cases, patients undergo surgery where a plastic band is placed around the upper portion of the stomach, making the stomach rather small, so that when they ingest food, they feel full very quickly, and they can't eat a lot. And as a result thereof, they start losing weight. I do all that through hypnosis. Why? Because in South Africa, I had a lot of experience. Before I went into primary care medicine, I had a lot of experience in surgery and OBGYN.
Oh, okay.
So I know exactly how to do the lap band surgery. So I do it virtually through hypnosis. And I take them through the entire operative procedure from the time that they're driven into the hospital until they are discharged from the hospital, in the operating room, the recovery room, the post-op care, etc., etc. Combined with that, they all get my 4 modalities. They get guided imagery with it, they get the nutrition aspect, and they get the exercise aspect. And it is those 4 modalities that make me the only physician in the United States who specializes in all 4. And every patient that comes to me gets it. I have had dramatic weight loss with it. People sometimes just do hypnosis for weight loss, and that's period.
Yeah.
Get into their psychological mind, into the subconscious to find out, and that's it.
So you're creating a virtual reality that in essence tricks the mind into thinking they had this surgery so that you behave just like you did.
Exactly. And every time before they eat, I show them certain ways that they visualize the band in place. They have to go through a mini hypnosis themselves prior to them eating, and I show them how to do that so that they are mini hypnotized by visualizing that in place. They see it in place, and while they're eating, I teach them how to eat mindfully instead of mindlessly. Mindless eating is we just shovel the food into our mouths and then eat and swallow. Mm-hmm. When you do it mindfully, you chew it very slowly, because why, Jean? From the time that the food is ingested into the stomach until the signal is sent to the brain to say, hey, stomach, I'm full, it takes 20 minutes. So if you just shovel the food into your mouth, even with a lap band in place, you can get far more food ingested, and therefore the weight loss is not dramatic. When you combine virtual lap band, mindful eating, nutrition, exercise, the pounds melt away.
Okay, well, I'm all for it. Away. I do want to take some time, because we are going to have to take a quick break here, to talk about, I'm getting you now, and I'm following you more clearly about visualizing and making a virtual experience real in your brain and in your body so that it can react appropriately. And that's how you can use that to help your body heal. So Correct. We only have a few minutes before break, but let's introduce our listeners to how that works. As you mentioned, you treat a lot of cancer patients. So I'm assuming you're helping them visualize the actual cells in their body fighting a disease, or I'm assuming here. So help me introduce this.
What I do is this. Excellent question there.
Thank you.
What I do is this. Each and every one of us have a special healing material that we think can heal ourselves. Example, a Pac-Man can go and chew up the tumor. A freezing machine can freeze the tumor. A fire can burn the tumor. Flowers can envelop the tumor. Asparagus can eat up the tumor. Well, you get my drift now. Mm-hmm. In other words, I ask each and every patient, what do they think in their mind could they send out from their brain to their tumor to destroy it? Each one has got a different one. If people have difficulty in saying, well, I don't really know, doctor, then for the older people who remember what the Pac-Man was, I say, how about us using a Pac-Man?
Okay, so stay right there, because we do have to take a quick break. But I'm with you, and I can visualize, and I can't wait to come back and go through this exercise in more detail. And then, yes, you will, a little hesitantly, be able to hypnotize me. So stay with us. We'll be right back. Hello, I'm Jean Pete, and I welcome you back to our show, Better Living. Better Living is brought to you by the Homestead Hope Foundation and is sponsored by Homestead Hospice, where commitment to education and premier hospice care helps patients and families through life's most important journey. Well, we're back. I'm Jean Pete, and just to remind you, I'm here with Dr. Mazansky. In the first half hour of our show, we talked about Dr. Mazansky being the only MD in the United States specializing in medical hypnosis and hypnotherapy, guided imagery, which includes visualization and meditation, and nutrition and exercise. We're talking today about how you can live your best life and use the techniques that Dr. Mazansky is going to talk to us in more detail about in this half hour to help heal your whatever ails you. We talked about in the first half hour how we can use this even for cancer patients as they go through the healing process in the fight of this disease. Dr. Mazansky also mentioned to me how useful it is with folks with chronic pain and insomnia, and really just as a de-stressor and to handle any situation that comes at you in life. And as I promised the first half hour of the show, I am going to let Dr. Mazansky hypnotize me. We'll see how that works for a brief 10 minutes, and then we'll sum it up from there. But first, I want you all to know Dr. Mazansky's story. He didn't just happen upon this. In my life as this radio show host, I realized that there is a path for all of us, and sometimes we realize it, and other times it comes to us like a ton of bricks, and we end up on the right road. Well, Dr. Mazansky has a similar story there. So, Dr. Mazansky, please let us know how you went from primary care physician to specializing in this field. What experience did you go through?
In 1985, I, like Lance Armstrong, was diagnosed with metastatic testicular cancer. The only difference being his went to the brain and mine didn't. It went throughout my body. My entire abdomen, my chest, everything was filled with cancer from a pea-sized tumor in my right testicle. At that time, we didn't have the treatments that we have today, and the severe nausea and vomiting that I went through was unbearable. My physician at that stage said to me, I must undergo medical hypnosis and guided imagery. Like most allopathic physicians, those are the physicians who write toxic medications. I said to him, oh, that's that CRAP, I'm not going to do that. That's abnormal, I don't believe in it. He insisted. Well, I was amazed at the result. From the severe nausea, as I said, they did not have the medication to calm the nausea and vomiting like they have today. That severe nausea and vomiting became a mild nausea only, allowing me to eat something and not having severe weight loss. It gets better. I was undergoing a 12-hour surgical procedure after the chemotherapy was completed after 6 months. My hypnotherapist told me that I can control my blood loss. I said, that is absolutely impossible. I'm under severe anesthesia. How can I stop that? She explained to me, she said, HM, your subconscious mind is far stronger than the conscious mind. Even although you'll be under anesthesia, you will be able to control your blood loss. What can you send out from your brain to stop the bleeding? Well, I had a lot of surgical experience, and I knew that from the time you tie the artery and vein, a certain amount of blood will ooze out, so I'll lose blood. I said my healing material, as we discussed earlier, will be super glue. She guided me and hypnotized me to send out super glue. I did that for 2 weeks, twice a day, as I instruct all my patients to do, 2 weeks prior to the surgery. I went for the surgery. The surgeon came in. He told me that the procedure would take about 12 hours and I'd use 10 units of blood. All he did for 25 years was to do testicular surgery and nothing else. I was extremely apprehensive because those were the days prior to HIV testing, and I had to have 10 to 12 units of blood. I had no option. Post-surgery, after 3 days after I recovered from the severe surgery that I had, which lasted 12 hours, he said to me, in 25 years, I have never seen this. I said, what was that? I thought he was going to give me a severe prognosis.
Oh.
He said, you used only 3 units of blood. I have never, ever seen this before. I said to him, Dr. Johnson was his name, I'll never forget him. If I had to tell you how I used only 3 units of blood, you would laugh at me. Thank you very much, you saved my life. And it was then and then only that I realized the power of the mind, how we can control our destiny. However, I had an extremely large practice. In those days, I practiced in Cleveland, Ohio, and it takes about 45 minutes, the actual hypnosis session. I couldn't devote that time. In 1994, I retired from primary care and came to live in La Jolla, California, which is the nicest place in the world, as we mentioned earlier. And then I started studying everything there is to know. Well, you never know everything, but I studied and became certified in medical hypnosis, guided imagery, nutrition, exercise, and then in 2011, at the tender young age of 68 years young, I decided to open the only practice, and here we are today.
Well, that's an amazing story. I love stories of self-empowerment. And folks, no matter how you feel about how much power you do have, I just want you to be open-minded during this half hour. I want you to just think about what it is we're bringing to you today. The show is called Better Living, and I also read a little quote about health. It says, health is merely the slowest possible rate at which one can die. And if we can help you slow that rate and live better for as long as we can have you here on Earth, then that's what I come back to you to do every week. So, Dr. Mazansky, what an amazing...
I would like to mention something to you.
Yes.
I tell all my patients, if you go onto my website, Dr. D.R. Medical Hypnosis, HYPNOSIS.com, drmedicalhypnosis.com. Go to my blogs. Learn first how you can prevent breast and prostate cancer. Read the blog about how taking a baby aspirin, 81 milligrams a day, if your doctor will permit it, after 5 years, you protect yourself against all types of gastrointestinal, colon cancer, rectal cancer, stomach cancer, etc. Go to the third blog on 11 cancer-fighting foods. I tell my patients if there's no history of breast cancer in their family, and if they take that formula, they will never have to have a mammogram. I can tell everybody that, because they're not my patients. There is so much information in the blogs, but those are the most important. On that same website are 25 different hypnosis videos, because I cannot have another person fly in to see me, because when it first started, it was great, because I'm the only physician who specializes in this. It was great, and I felt proud that people flew in to see me, but it caused a great deal of stress, inasmuch as the planes in America were always late. You have no idea what the last 2 weeks have been like, because under severe duress, I accept patients if they're friends or friends of friends. And some of them flew from the East Coast, and they had to cancel because we all heard of the severe weather.
Right.
Now I'm playing catch-up. But that aside, there are those 25 videos, cancer being one of them. They download that to their computer, and being an empathetic physician that I am, every person who purchases any video gets complimentary weekly follow-up telephone calls from me. I even do some via Skype for people overseas.
That's wonderful. And how many programs does it typically take? Like, how long does someone have to continue to go through this before they can continue it on their own?
Immediately, because those who I see in the office, I see once and once only. It's not necessary to see them more often, because they bring their cell phone or handheld device, they record the interview, and they listen to it twice daily.
Wonderful.
With them also.
Okay.
They get weekly complimentary telephonic calls from me so that I can monitor the progress. It's not just in and out. Each consultation lasts 90 minutes, uninterrupted, unheard of today in the medical field the way it is,
Right.
that a doctor will spend 90 minutes, because it takes that time to give them the nutrition, the exercise, the hypnosis, and the guided imagery.
Let's talk.
They
Well, first
get
of all,
weekly telephonic calls. Excuse me?
First of all, I want to get your website out again. Again, folks, please go to Dr. Mazansky's blog and take a look at his internet hypnosis videos and peruse his website. It's Dr., and that's the abbreviation, DR, medicalhypnosis.com. That's Dr. Medical, HYPNOSIS.com. Now, can we give out your office number as well?
Yes, absolutely.
Okay. Now,
It
again,
is-
he's located in La Jolla, California, but you can reach him at 858-320-0021. And we're talking today about medical hypnosis, hypnotherapy, guided imagery, which means you're visualizing and meditating about how you can heal yourself. So we've talked about how that helps with cancer patients, chronic pain. Dr. Mazansky, do you want to give an example or a story, or are we going to run out of time and not have time to hypnotize me? Whatever you think is most important for our audiences to hear.
Well, I think it would be better served if I do a mini hypnosis on you,
Okay.
so that people can understand if they decide to use any of my videos or come to see me, which I would value, what they're going to expect.
Okay. So Kelly and Catherine, my producer and my assistant, who Kelly, I'm proud to say, is actually a medical student.
Kelly, she didn't tell me that.
She didn't. She's a
That's
smart
very
cookie
nice.
over there. So they're going to watch out for me here in the studio, as I'm a little trepidatious here, but I'm going to be open-minded because you seem like a great guy. Okay, so what do we do now?
Please relax.
Okay.
First of all, I want to know, what is that place that you go to where you find complete solace and rest? Is it a beach?
It's Hilton Head, South Carolina.
Is it where in South Carolina? A
Hilton
beach?
Head. It's
Hilton
the beach.
Head,
It's
fine.
kayaking
Okay.
first thing in the morning and seeing all the
fine.
wildlife.
We just do Hilton Head.
Okay.
Now, what I want you to do, I want you to remain completely relaxed. Don't hold anything in your hands. Just relax. Together, we are going to breathe in and out 6 times. Breathing in through the nose, fresh air, exhaling toxic air, and 6, 5, 4, 3, 2, 1. You are relaxed. In your mind's eye, visualize now yourself at Hilton Head, South Carolina. Appreciate the beauty around you. The sun is shining bright. Feel the warmth enveloping your entire body. Smell the fresh water as you visualize yourself kayaking down the river. You are so relaxed. You are free of any tension and worry. Listen to the birds chirping, the sounds of nature. Listen to the children about the riverbank, laughing and playing. This is your place. You feel so good. You are totally in heaven. You are relaxed. In your mind's eye, visualize now the muscles of your left leg. Relax each and every single muscle fiber. You can see in your mind's eye the muscles relaxing. You feel the muscles in your calf completely, utterly relaxed. Similarly, relax now the muscles of your left thigh. Watch as each muscle fiber loses its tension. All spasm and tenderness is dissipated. The entire left leg is completely relaxed. In your mind's eye, visualize now the muscles in your left arm, the muscles in the forearm, the muscles in the upper arm. Relax each and every muscle fiber. Feel how you are going deeper and deeper, relaxing, becoming more and more relaxed. You are feeling calmer and calmer. Each and every muscle fiber in your left upper arm and your left leg is relaxed. In your mind's eye, visualize now the muscles of your right leg, from your ankle right to your hip bone. Relax the muscles of the calf. Feel them, how they are becoming relaxed. Each and every muscle fiber is losing its tension. The heaviness of the leg is gone, spasm gone. You feel you are sinking deeper and deeper. You are becoming calmer within yourself. Visualize now the muscles of your right thigh. Relax each and every muscle fiber. See how your right leg is completely and utterly relaxed. Your left leg and left arm is relaxed. Your right leg is relaxed. Your total body has become calm and calmer. Relax now your muscles of your right upper arm and lower arm. Visualize how you can relax them. In your mind's eye, go back now to Hilton Head, South Carolina. Visualize the beauty. Stay there for a while. In your mind's eye, visualize now the muscles of your neck, left and right side. Relax each and every muscle fiber in the neck. Your neck before had some tension or spasm. Release that from you. Visualize now the muscles in your upper back. Relax it. Visualize how they're becoming relaxed, free of tension. Feel how your body continues to sink deeper and deeper. You're becoming so calm and relaxed. You feel wonderful. In your mind's eye, visualize now the muscles in your lower back, often an area of contention. Visualize it on the left and right side of your back. See how the muscles become so relaxed. They have no spasm. They have no tenderness. Your entire body is now totally relaxed. You are so calm. You're sinking more and more deeper and calmer into total relaxation. You are oblivious of everything about you. In your mind's eye, visualize now a bright blue healing light sitting on your forehead. It is your light. Visualize that light enveloping your entire head and your brain. Visualize how it turns itself into a vacuum cleaner, extracting all stress, anxiety, and tension from your brain. Visualize how those feelings of negativity in a state of complete and utter calmness, those are being sucked up into the vacuum cleaner. Progress that blue healing light down your mouth. Inhale it into your lungs. Visualize how it scans your lungs, finding no tumors. Your lungs are completely healthy. Swallow your blue healing light into your stomach. Your stomach is beautiful and normal. It is clear. Visualize your blue healing light scanning your breasts for all tumors and lumps. Visualizing none, your breasts are completely healthy. Visualize now your blue healing light scanning your heart. Your arteries are all open. Your heart is pumping well. Your blue light progresses down your entire abdomen, healing and scanning your kidneys, which are normal. Visualize as it goes down and down and down to your pelvic area. Visualize it healing your uterus and ovaries, scanning for cervical cancer, uterine cancer. Your uterus, ovaries are completely normal. Visualize now as the whole healing blue light envelops your entire body. You are totally healed. You are free of any disease. You are well and healthy mentally and physically. Jean, it is now time to come back to the here and now. I want you to start wiggling your toes. Start wiggling your fingers. Move your ankles up and down. Flex your wrists. Bend your elbows. Open your eyes. Jean, you are healed. You are back to the here and now.
Thank you so much. I have to tell you, it's hard to do that in a studio. But
I know, but I did.
I want my folks to understand there is a power, and I can imagine it to do it again and really hyper-focus in visualizing that blue light just going through your body and wiping everything out. I can see, I am open-minded enough to know that I do believe we are all self-empowered, and I appreciate you bringing our audiences through that. Unfortunately, we're out of time, but I can tell you, far more relaxed than I was when I came in, and nervous when this whole thing started.
Let me explain something to you. When you come to the office or you do it at home, you're there by yourself.
Right.
You're not in front of an audience. There is a certain amount of anxiety and tension.
Yes.
When you're in my office, it's one-on-one. So obviously, when I did it on television, there was only the guest and myself.
Right.
But with you had two other people. You have your whole audience. Obviously, it's not the same.
Yes.
But I just wanted your audience to get a feel, and I rushed it. I did that in 10 minutes.
Yes.
I mean, I spend sometimes 15 to 20 minutes on the relaxation side alone, and then...
Well, I'll tell you what I'm going to do. I'm going to go to your website, and I'm going to pick one of your videos. And maybe we'll have you back after I play guinea pig a little bit. But folks,
I suggest you download is the Brain and Body Massage Ultra Relaxation. It does just that.
Okay. So folks,
download it to your computer first.
Okay. And I will get back with you. And again, we're talking to Dr. Hillel Mazansky from La Jolla, California. You can contact him at 858-320-0021 or go to his website at drmedicalhypnosis.com. Please check out his website and blog if you want to learn more about medical hypnosis and self-guided imagery to help you live your best life for the rest of your life. I'm Jeannie Pete. Thanks for listening. Have a blessed day and week ahead, and listen here same time next week and every week. Homestead Hope Foundation is your resource for a healthy life. God bless.